Brought to you by PharMerica, your long-term care pharmacy experts. Discharge RX makes the discharge process easier than ever and more valuable. Through this seamlessly integrated program, your residents will return home with a supply of medications for ease and convenience. And your facility realizes 3 big benefits as well. Improved post-discharge adherence with up to a 30-day medication supply and pharmacy follow-up directly with the resident. Reduced hospital readmissions by up to 8% through reduced drug errors and improved outcomes. Demonstrated savings of up to $4,000 a month with simplified billing, less unused medications, and fewer CMS penalties. Discharge RX, redefining the return home. Visit www.pharmerica.com to learn more.
Assisted living development. What trends do you see these days in assisted living space?
The trends I see now is similar to what we saw in the early 2000s, overdevelopment of assisted living. Assisted livings in the early 2000s really were ramping up. They saw this market where they were going to be able to jump in, and everybody and their brother was jumping into it back then. We saw a lot of acquisitions that happened back then. But what we're seeing today is an overdevelopment of assisted livings today is because of the incoming Silver Tsunami is what people are anticipating. Plus the REITs and venture capital have a lot of money out there that they need to get working on the streets for them. So they see this as an area that they can get into and develop assisted livings. What they don't realize is that they're developing today for the Silver Tsunami, which is not going to happen for another 15 years.
Right. Do you see this as even across the country, or is it regional still where you see
I think it's across
pockets?
the country, sure.
Okay.
I can say I operate in New Jersey. I have 18 communities in New Jersey, and we are a CN state. And when I look at the CN list, there's going to be an assisted living on every corner if all those assisted livings get built in the state of New Jersey.
Right. What about, are they serving every market? I know there's been a lot of talk about the middle market or even lower middle market, income market, not being able to afford a lot of the assisted living out there.
Assisted living is predominantly a private pay industry. There are Medicaid waivers out there, and there are some companies that do specifically the lower income. But I believe what's being developed today is the assisted living for today's senior, but as we move into the future, they're going to need to be more moderate assisted livings. And the reason I say that is because when you look at today's demographic, our generation we're serving today is the greatest generation. Those residents bought their houses for $4,000 and sold them for $400,000. Plus, on top of that, they came from a pension plan where the baby boomers in the 1980s, where they switched from pension plans to 401ks, they didn't invest into the 401ks. They should have, and the pension plans were gone. Plus, the homes that they bought were overpriced, and a lot of them lost money on their houses versus gaining money on their houses. So I don't think that generation, when we get 20 years into the future, is going to be able to afford what today's product is. There's going to have to be a more modest assisted living.